What more could be done to help combat Canada's opioid crisis?
To combat Canada's opioid crisis, I'd say that we need accessible kits for people that have overdosed and more awareness around it. A lot of people think it's the person's fault, but it can be an addiction, and it's not their fault. So having more awareness around it and accessibility to narcotic kits and stuff like that to help them.
I think safe injection sites are something that's been proven to help Canada's opioid crisis. You know, I think they're big in BC more than they are here, and there's a lot of evidence that shows that they really help, and just decriminalization in general.
We can have better healing centers. We can have recovery programs. We can also have support our non-profits, because they support the people that are either facing opioids or on methadone or things like that. And the other thing we can do is support the ones that have not yet gone into that slippery slope. Yeah, so that's that we prevent others from getting into that situation.
We're not taking a holistic approach to health, and we need to start looking at getting healthy foods in and getting people who have a roof over their heads, and then maybe there won't be in as much pain, or maybe they'll be able to seek alternative therapies and medicines to help, rather than just asking a doctor for a prescription. The doctor's overworked, they don't have time to get to know their patients. 150,000 Nova Scotians have no doctor, so they're just going to a walk-in who has no background on them.
That's tough. I've heard some different opinions between whether it should just be like fully legalized or whether we should lock down on it. So I'm not sure. I think that issue is pretty deeply rooted because it's got a lot to do with mental health and stuff. So it's if people are hurting and you take a substance away from them that's helping them, then they're just going to look for something else if the problem's not fixed at the root.
I have a lot of friends that have been in recovery and have made it through and whatnot, and the programs are getting a lot better, but I feel like the biggest thing that got a lot of people into it was doing them when they were too young. And I just feel like a lot of those opioids or those stronger medications when you are young, I feel like that should be really, really looked at, because I find that's where a lot of the addiction does come from, when you're younger and stuff like that, and you just don't understand the risks.
Opioid, alcohol, tobacco, whatever. It's not an easy thing to fix. So I don't know. What they're trying out west is decriminalizing it. Is that going to work? I don't know. I don't think that helps get people off the drug.
The opioid crisis is awful, and it's one of those things that I luckily didn't have to deal with when I was growing up. I think we've seen some positive things south of the border in terms of holding some of the companies to account for the practices and policies that they had that led to these things becoming so widely available. At the end of the day, though, I think one of the most difficult angles of this is the fact that much of these are probably being produced illicitly overseas and making it into Canada through, frankly, channels we can't regulate. So as much as I think it's important to treat addictions as a public health issue, I think it is really, really important to try to identify how these types of drugs are making it into the country and see what steps we can take to address them.
Decriminalizing. Building support for the opioid crisis into the healthcare system and destigmatizing it is the only way people are going to feel safe.
I would say education for younger generations, that's the first thing, and also trying to give people the mental perspective on why people are using opioids. So most people don't really know how to handle depression and other mental illnesses, so you find people looking for an escape. They're just trying to run away from that dark place that they're in for a few minutes. So they end up taking things that end up drawing them further into that dark place. So I would say it's more of a mental health thing that people need to study first before just saying don't do drugs.
Unpopular opinion, needs to be decriminalized and legalized and made so that it is not. It's not dangerous to seek help for treatment. If it's illegal, and people can't come forward without being arrested when needing help, then they're not going to go for help, and that just makes this cycle worse.